African community in United States of America, is it a double minority group? That is the question that we have been asking ourselves, and this is part 3. Why are we interested in this topic at this time? The reason that I am interested in this topic at this time is as the African immigrants continue to make up an increasing percentage in the US populations, it is an essential to understand the extent to which their health changes post-resettlement. We talked about that immigrant health effect, which is they come as a healthy people and their health status changes longer they stay. And also we need at the same time to understand the factors that contribute to these changes. So why African immigrants, African born blacks from the continent of Africa? What happens and how it happens, and do they have a unique status or problems that differentiate from the rest of the African community, Afro-Americans in the US? We emphasize the uniqueness, the issue that's facing African immigrants from the US because they have experienced a physical and psychological trauma because of the civil wars that took place in Africa. Many countries like Somalia, Ethiopia, Liberia, Eritrea, Rwanda, Burundi, Sierra Leone, Liberia, you mentioned, Congo, Sudan, Chad, Ivory Coast. It is across Africa. So those people, some of them we mentioned in our programs the previous 2 sessions. So that war had an impact on their health, whether they were physically injured or whether they psychologically injured. And a good example, the psychological trauma that some of the Africans face, we picked this testimony from a study that Jennifer Carroll did in Rochester, Minnesota. A 38 years old woman of Somali origin in Minneapolis said this: "My father was killed in the war. They wouldn't even let us bury him. They just let his body stay there. My 2 eldest brothers, they tried to bury him, and they were killed too. I had to leave the very day my brothers were killed. I am haunted by this still. To this day, I have a brother and a sister missing. I don't know where they are." That is an excerpt from a statement that a 38 years old woman living in Minnesota state. So we are learning that this person experienced a horrendous experience. Her father was killed in front of her. They couldn't allow them to bury him. Her brothers were killed in front of her. And those kind of experience, and her brother and sister are still missing, though nobody knows their whereabouts. Those are still coming, those memories are flashing back while she lives in USA. So those kind of trauma, psychological trauma, if they stay past 6 or 3 months or 6 months or year or after a year, still coming up, we don't know how far or how deep is this syndrome, which is the post-traumatic disorder syndrome. It impacts the life of many Africans because it's not only Somalis who experience this kind of civil war. There is also another study that looked Somalis and Oromo youth in Minnesota. 338 Somali and Oromo youth were studied about their trauma history, their life situation, and skills for physical and psychological and social problems they are facing in the US. So they started to find out that the youth with symptoms of post-traumatic disorder syndrome, they reported more traumatic events. So the people who had more traumatic events, they were manifesting PTSD. And the trauma history were strongly associated with physical and psychological and social problems in US. So what they found out was the physical problems, any youth who has psychological problems or social problems at the schools, in the or adjusting or any other issues, when they started, they found out that these groups or youth, they had a trauma which was very severe. When you look at also another study that looked the Sierra Leonean child soldiers in US. So this study, what they found out was the children who perpetuated injury or killing reported greater levels of depression, anxiety, and hostility. So in our video or session 2, we saw child soldiers, how they do and how they were involved in the killings in the civil war in Sierra Leone. So those kind of children, when they came to US or any other places, and they found post-resettlement stressors, so they got they showed greater levels of depression, anxiety, and hostility. The hostility part is the most dangerous part. And also the male former child soldiers who lost caregivers were more vulnerable to depression and anxiety. Strong and significant effects noted among male child soldiers. This study looked female and males, but the males, they were more vulnerable to depression and anxiety. So these children in US, they are having mental psychological issues because of their past history. If you look another study in Boston that looked at the lost boys of Sudan, as we know, there were thousands of youth from the southern Sudanese who came to the United States through either Kakuma or any other refugee camps from Kenya and was resettled in US. So these youth were called lost boys because they were unaccompanied, so they had no father and mother or any other adult supervision. So about 304 Sudanese refugee minors were put into a foster care through the US Unaccompanied Refugee Minors Program. So these people, they got an American sponsors of foster care. And then they studied, as reported in Journal of Immigrant Mental Health. The majority, 76% of those young youth from Sudan, reported seeking medical care for symptoms and problems often associated with behavioral and emotional problems. This group, if you read more on this study, they got a very superior counseling. They got a superior services. But the majority of them, they were seeking help on mental health issues and behavioral emotional problems. So those are the people that we are talking about. Even the youth who were unaccompanied, who got the foster care in US, getting a better health care, better counseling, better mental health issue counseling and treatment, but they are still looking more care on behavioral and emotional problems. There was a study in Boston also about Somali youth. So in this study, there were 144 youth from the Somali origin. Those youth, 70% of them, they witnessed violence, killing, armed combat. They saw them. 47%, they assaulted or injured, or they were either assaulted or injured. 34%, they believed that you would be killed. So those are the things that they believed that made them run away or run with their parents. 43%, their loved one was killed. 50%, they remember that they had a prolonged separation from the loved ones. 33%, they had extreme deprivation. So a study group of 144 kids from Somali origin in Boston, this is what they're experiencing. And also, this is the trauma part, but what about the post-traumatic stress disorder syndrome? This group, nearly 2/3 of youth, they reported significant post-traumatic stress disorder symptoms, and 1/3 they were screened as they had full PTSD. 1/3 they had a full PTSD. That is the red. 33%. 1/3 they had a full PTSD, and 29%, which is the partial PTSD, but only 38% of this group they didn't show any symptoms of PTSD. So post-traumatic stress disorder, as we know, it is the disorder that brings back all the bad memories, all the bad experience that you have had either back home or in here, and then whether your parents were killed or your sister was raped in front of you, all those bad memories that haunts you back comes and all tricks you to a same way that sometimes even you can't do anything, feeling hopeless, those kind of things. So one of the issues is the kids who came to US, they had a terrible experience. This girl is from Somalia and she's talking about her experience. She came with her aunt or relatives, and then she experienced moving one state to another, Tennessee to Ohio, Ohio to Minnesota, Minnesota back to Utah, those kind of. And then there is also racial discrimination and psychological distress. These immigrants, they perceived or they experienced discrimination because of their race, and it had an impact on their health, because these women, they are new to this country and they dressed the way they used to dress back home because of their culture. These are women from Middle Eastern background, and these women are East African or Somali background, and they live in Boston or Maine. And these pictures are taken from Project Shifa, Boston, by Heidi Ellis. So these people, they experience, because of the different culture, because of different religion, tremendous, they experienced or they perceived discrimination, which had a toll in their life. What about the kids in school? So these children from Somalia or East Africa, they perceived discrimination. For example, these are an excerpt from the qualitative interview in 2003 to 2005. One of my cousins got teased for wearing a garment on an MBTA, the school that they go, because of wearing this kind of hijab or long dresses. You are teased. Why this wild? Why are you wearing? Why don't you look like us? Some guys was like, go back to your country, we don't want you people here, you type of people. Those are the things that people felt. Small innocent children whom were brought to US. This is the starting point, perception and discrimination and experience they had in schools. And people started treating them, Somalis or Arab people, differently, like they are bad people because they are Muslims. So this is coming from an elementary school child of African heritage. Also, people don't know the difference between who bombed them or who is Muslim. They just treat you the same. All of you are bad. That is what we are learning from kids from African immigrants. So schools, all the places of work, at home, community centers, you don't feel safe. You feel that you are discriminated. You feel that you are sidelined or singled out for airports, work area. So this is the experience of the Africans in America. Even the cab drivers feel that robbery, discrimination, hatred, killing. We didn't know that this would have happened to us in America. It hurts your feeling. Different categories. We are immigrants, black, and Muslims. Being an immigrant, being a black, being a Muslim, those are the three killers that these people faced. Even if you are Christian, your Christian religion is totally different from the Christian that these people practice. So then what is the consequence of the traumatic stress that this community is facing? So socially, there are school failures. People are not doing well in the schools. There are antisocial behaviors. There is isolation and withdrawal. People are withdrawing from schools and from learning, from even feeling the apathy of learning. Drug abuse, psychological post-traumatic stress disorder, which is re-experiencing avoidance and hyperarousal, depression, conduct disorder, emotion regulations. Those are the consequences that this community is facing. But the good thing is, a study that looked how these people are coping. Somalis and Oromos in Minneapolis, most frequently strategies to combat sadness, which is depression, sad, being sad, feeling sad, which is really either anxiety or emptiness or hopeless, or individuals that feel that restless. So people, they were trying to cope using this tactic. 55.3% of the youth in Minneapolis of Somalis or Oromo background, they were using a prayer, praying to their God, praying to Allah. Some of them, they were using, 40% of them, they were using sleeping as a tactic. This strategy of sleeping day and night, maybe staying awake in the night and sleeping a day, so you don't meet anybody. So you are sleeping and using that tactic, and it is working for them. 40% are using to cope their sadness through sleeping. Some of them, they are using reading. Some of them, they are using, and they were using this strategy with talking to friends, using the cell phone throughout, or landline phone. That is the technique that our people are experiencing. Prayer, running to Allah to God to save you from this emptiness and hopelessness. that you are experiencing, and nobody is really trying to get the services that this community needs. On the other side, also the community are not knowledgeable or aware of this is a treatable condition or disease, that if they seek help they could be treated. Because of the mistrust of the health care and health system in the country, and the complexity on the healthcare system of the country, which is not suitable, competent enough to help these communities, are really, so kids are, or the community are falling on the cracks, and they are ending up into jails. So Somalis, they feel in the jails. Oromos, Sudanese, there is African immigrants who are now becoming a big part in the detention centers, whether it is juvenile detention. So he is talking about the disproportionality of the Somalis or African immigrants in the jails, in the detention centers. So why this thing is happening? This thing is happening because, and some of them, it is a big study in issues, mental health nurse. If I was going to kill myself, I wouldn't be calling you and asking you for help. That was the title of a study in 2011 on African immigrants, women especially. Because these people, when they were asked, do you think about killing yourself? Or do you go about, how do you go about that? Do you seek help? So this community, if they decide killing themselves, calling 911 or seeking help is really strange to them. And that's what we see on this title. If I was going to kill myself, I wouldn't be calling you and asking for help. Why would I? I decided I want to kill myself, then I do it. I go ahead and do it. Why would I call in 911? Am I that kind of coward to call a 911 or help? So there is a lack of awareness about mental health issues influence how they seek help to manage mental illness. There is a lack of awareness in the community about the mental health issues. And also there is a lack of appropriate services that suit these African communities' needs to access mental health care. There's no appropriate services that suit their cultural needs and their behavioral and that kind of thing. So there is a gap between lack of awareness in the community, there is a lack of appropriate services in the system. So the women often draw upon informal support system and practices and self-care strategies to cope with their mental illness and its related problems. So what do? So instead of going and seeking help, they look for their own way of support system. Do they seek help? What do? Rather than seeking help from a clinician, participants, they prefer to first use family support, prayer, and traditional therapies for most situations. That's what they did. I would go and use my religion. I would go and use what I believe, traditional therapies. Whether it is right or wrong, that is what they feel happy with, because of not knowing, or if they do know it, there is a mistrust, and the system ready to take that step? Is the American system ready to go that extra mile to reach out to these communities and help them before things get out of hand? And one of the problems that I do feel and which is the title of this presentation, is where these communities, they are double minority. And the reason I do say that is they are African blacks, and they were counted in the Afro-American blacks. And the states that they call, we are the majority. For example, in Minneapolis, if you look the Liberian community in Minnesota, or Somali community in Minnesota, or Oromo community in Minnesota, or Ethiopian or any other communities, they consider themselves as in a good numbers. But if you look the data from the census, 85% of the inhabitants of Minnesota state are white, Caucasian black, whites population. There is only 5% of the blacks. Those 5%, it's not for Somalis or for any other African immigrant. It is all people who share that black color, whether you are from Africa for the last 20 years or whether you came centuries ago. That 5%. That's one thing. And then the question is, this community that I am talking and interested in, they are also a minority in the African American community. So because of they don't share with same culture, they share the common color, but that color also is not the same color. Culture. If you look into Washington state, 77, these two states, they are two of those white states. So 77%, only 4% are blacks. Those 4%, if you look, we got in Washington state, there is a big East African community, West African community, Zairian, Middle Central, and Rwandese and Burundese. But if you put all those numbers, they are not even 1%. African Americans included, they are 4%. And that's what makes them to come under this invisible, and I don't know, because all the services are targeted, because the bigger minority group are the African Americans. Whenever you call minority in US, who are they? African Americans, whether in Washington state or Minnesota. Hispanics. So those communities, they got a bigger health services, whether it is CMAR for Latino groups, whether it is African American clinics, and then or other types of services programs. So these African communities, unless there is a special attention, we look for the numbers and see them and analyze them, and then get them the help they need before it gets bad. There is only 6.2% in California of black American, 12% in Ohio, 15.7% in New York. And we talked about there is over 500,000 people from the continent of Africa for the last 20 years in New York. So those 500,000 people, where are they? Are they noticeable in this percentage, 15%? I doubt. So those are the things really I want. And when I ask Southern Sudanese or Somalis if they consider themselves African Americans, yes, they are African Americans, but at the same time they are African blacks from the continent of Africa who came lately, and they need the attention they deserve.